What's going on, Wolfpack? I'm finally back. I know it's been forever. This last semester at UNLV was wild. I finally got my giant literature review done. I completed my comprehensive exam, which involved giving a presentation on my proposed dissertation and also using my literature review to help with the rationale of that dissertation project. And it was a whole bunch of questions, but a whole bunch of learning along with it. My committee really grilled me, and it was a lot of fun. But I got it done, and I got all my coursework done, which means I have every single requirement done for my PhD, other than completion of my dissertation and defending it. So I can finally take a nice deep breath here, at least for a couple weeks, because I am in the process of recruiting um, participants for my dissertation project already, and yeah, it's going to be a fun ride this next year. So I have a really fun project. We're doing differences between crouched walking and upright walking, and also how your lower body uh, lower body strength and anaerobic capacity predict your ability to perform well in a crouched walking task. Um, I know that could sound a little bit confusing right now, but it's important for military human performance research, and in particular for any military members involved in close quarters combat. So, um, special forces in particular, but also law enforcement too, like SWAT teams. Um, they see close quarters combat a lot, especially if they need to go into a building and clear out threats or anything of that sort. So it's going to be a really really cool project. I'm looking forward to it and seeing what we find out. But um, yeah, so episode 21. Before I get into it, I want to talk to you real quick about my two books and kind of promote them a little bit more. So I feel like not a lot of people know about them, so I'm just going to start talking about them a little bit more, and hopefully, you get some really, really good value out of it. So the first, well, actually, my second one, it's called Awareness Before Action. I just published it in July, and it's available on Amazon in paperback, hardcover, and also Kindle version. And I'm currently working on editing the Audible version. That's been taking a really long time. I'm really hoping to do a lot more of that over the next few weeks um, while I'm on break from school. But I have everything recorded. It's just, man, I got to do all the editing of the audio and everything, trimming everything down, making sure the audio quality sounds just right, so it doesn't get rejected and everything. But it's gonna get out there next year. So that's that's the expectation. It'll be out there in 2026, and then you could just listen to my beautiful voice rather than sitting down and reading, which I know can be very difficult for a lot of people in the era of phones and Netflix shows and all that stuff. So, but anyway, about the book, all right, it's a sustainable lifestyle book. So, my goal with it was to really get people to start thinking about how they can shift their mentality away from a fad diet approach, from a 30 or 60-day quick fix exercise program. All right, they work. However, do they actually work? Because do they promote sustainable weight loss? No, they don't. Because the vast majority of people, all right, they might lose that weight a little bit, or they, improve their body composition, they reduce body fat, they gain some muscle, they look more toned, and then they just lose it all because they don't have principles to fall back on, um, that enables them to live a healthy lifestyle and maintain that new healthier weight that they found for months, years, the rest of their life. Okay, so that is what this book is all about. All right, how to lose the weight, how to be lean, lean enough, healthy enough, all right, and maintain it for the rest of your life. All right, and you don't do that through strict, rigid programs. You do that through understanding certain principles and certain questions that you ask yourself every day that you fall back on when you're tasked with a decision-making process of, hey, is it okay? Can I afford to eat this food right now? Or should I be eating something a little bit healthier? Is it bringing me closer to my goals, or is it bringing me further away from my goals? If it's bringing me further away from my goals, can I accept that and not have any guilt or shame behind it, accept the consequences of it temporarily, and then jump right back on, to the Whole Foods, the next day or the next meal. All right. And the same thing goes with fitness. All right. If I miss a workout today, or if I miss 2 or 3 days because life is getting in the way, am I just going to throw in the towel, or am I going to accept that, hey, life got in the way? All right. I'm going to go back into the gym the following day and I'm going to get after it again. All right. And I'm not just going to throw away all that hard work I did. All right. Just because I've been met with a couple obstacles, right? So that's the whole idea behind the book, is psychology based, how to think about all this stuff, how to ask yourself the right questions at the right time, and how to follow through with those questions too. And it's a constant process. If you want sustainable weight loss the rest of your life, it's principle based. All right. It's a lifelong process. It's as simple as that. It's a lifelong process, and you have to get into the mentality of that. Okay. So check out the book on Amazon, Awareness Before Action. Second was my first book, Skate, Lift, Recover. Jeez, I got to really move this back here. All right. This was my first book. It's a lot bigger. A million pictures in here. And it's actually color. All the pictures are color, which is really cool. But it's also very expensive to print that way. So for my second book, I did black and white photos, but they're still pretty cool. Anyway, Skate, Lift, Recover, that's for hockey players, any hockey player 14 plus. It's meant for high performance hockey players, meaning those that are very competitive, looking to play in, double A, triple A, travel, hockey clubs, college, but maybe even go and play professionally somewhere, right? So that's what it's really meant for. However, that does not mean that if you're just playing recreationally, or you're playing in a house league or something like that, or it's not that serious, that you're not going to get any benefit out of this book. You're going to get a ton of benefit out of the book, no matter what level of hockey you play at, all right? But just all the methods in here go from the most basic to the most advanced. And all the programs in the back of the book are basic. There's the basic version and the advanced version as well. So it's going to help hockey players develop speed, power, explosiveness, cardiovascular fitness, conditioning, strength, but also that last word, recovery. All right, so there are a ton of stretches, self-myofascial release techniques, breathing techniques that you can use on a daily basis to make sure that you're recovering from all that strenuous training and getting right back into it, the next day or the following day, so you can continue to perform at a high level. All right, so if you're a hockey player, or if you're a parent of a hockey player, or a hockey player, so I'm assuming a lot of my listeners, or you're at least one of those categories, all right? Check out the book on Amazon. That's available on paperback and Kindle. And you are going to get a ton of benefit out of it, and improve your hockey playing in every way, I promise you. Also, if you're an adult league hockey player, you need it. Sorry, you just straight up need it, all right? Don't worry about the high performance thing. Once again, you don't need to be a high performance or want to go to the NHL or play semi-pro or whatever. All right, every single one of those exercises and techniques you can use to some capacity to get yourself out of pain, to skate faster, to last longer on the ice without being dead at the end of a hour and 20-minute hockey session. All right, so adult league, beer league players, this is for you too. Okay. So enough of this intro, guys. Go check out those books. buy them on Amazon. And also, please, if you read them or you are reading them, please leave me a review. And this is going to help me get these books out to a lot more people. All right. So before I get into this podcast episode, please take a moment to follow and rate the show. Once again, that's going to help with visibility and getting the podcast out there. Share it with your friends, family, and colleagues. All right. And lastly, before I get into the episode, I always want to make it known that this podcast is separate from my teaching and research roles at the University of Nevada, Las Vegas. Okay. So before I get into it, this podcast is all about peptides. It was really, really fun to research this area of health and wellness. I knew hardly anything about peptide therapy before I did the research for this podcast, and I've really only scratched the surface of it. But there are a ton of valuable nuggets and information for you to understand if you're interested in peptide therapy, where to even start, what the benefits are, who are trusted providers, some of the most common peptides that you can use for therapy, and what they can help with. All right, so I really hope you guys enjoy the show. Let's get to it. All right, let's talk about peptides. So what are they? Peptides are naturally occurring molecules in the body, and they're made from short chains of amino acids. So approximately 2 to 50 amino acids that are linked together. Those comprise peptides. And amino acids, those are the simplest form of broken down protein in the body, but they also serve as the building blocks of proteins. And proteins are larger chains of amino acids compared to peptides. So those are going to be over 50 amino acids linked together. So some amino acids can be synthesized in the body. So there are 11 non-essential amino acids and 9 essential amino acids, which means that they need to be ingested or consumed in your diet. So they are essential for you to consume. And 3 of those essential amino acids that you might have heard of are isoleucine, leucine, and valine. And those are known as the branch-chain amino acids, which are especially important for muscle building. And there are also some amino acids that are conditionally essential, meaning they become essential in certain circumstances like trauma, surgery, severe burns, or certain illnesses. So examples of those amino acids are arginine, cysteine, and glutamine. But I'm not going to get into those in depth in this episode. So amino acid functions, before I actually get into peptides, I want you to understand why amino acids are so important in the first place. They form proteins within the body. And proteins can act as enzymes, meaning that they speed up critical chemical reactions within the body to do what it needs to do on a daily basis. And proteins also provide structural support for your body. So your muscles, your skin, and all of your organs are made of proteins. Hemoglobin is a especially important protein as it transports oxygen. And without oxygen, we do not live. So there you go. There's another key example. Next are antibodies or immunoglobulins. Those are proteins as well. And they identify and neutralize foreign invaders like bacteria and viruses, and they're a crucial part of the immune system. And many hormones like growth hormone and receptors located on or within cells, those are also made of proteins. And hormones are chemical messengers that regulate nearly all bodily functions, and they bind to your receptors to perform those functions. So, long story short, amino acids are super, super important. Now, going back to peptides, peptides have specific roles related to metabolism, tissue repair, cellular repair, hormone regulation, and immune system support. Now, there are endogenous and exogenous peptides. So, endogenous peptides means that they are made by the body. Exogenous peptides must come from outside sources, so like foods, supplements, or therapies, which we're going to be I'm going to be talking about later in the episode. And these peptides work alongside your body's natural peptides, those that you ingest. And they have targeted benefits to fill specific gaps that you may have or to enhance certain functions within the body. And they're involved in so many functions, so therapy can potentially help with something. So, how do peptides work within the body? They're signaling molecules that attach to specific receptors on cells to trigger what is known as a cascade of biochemical processes. And like I already mentioned, they can fill gaps and optimize specific functions within the body. And some more of those functions are weight loss, muscle growth and athletic performance, promotion of healing and recovery of tissues, balancing hormones, and also improving skin elasticity and collagen production. And there's various delivery mechanisms, in particular for exogenous peptides. So here are a couple of those delivery mechanisms. First is the subcutaneous injection, which is the most common, and injections are typically preferred to get them straight into the bloodstream. Now, the pros of the injections are maximum absorption without getting broken down by the digestive process. But the cons requires regular injections and it may not be ideal for everybody. Some other delivery mechanisms are capsules, and the pros of those are that they're convenient and easy to take, but the cons are that they may be broken down by the digestive system and it may limit their effectiveness. There are also nasal sprays. Pros of these can be that they can deliver straight into the bloodstream as well through the nasal membranes and bypass digestion. Cons are that those may cause nasal irritation with frequent use. And lastly, there are also topical creams, and that's most commonly used for skincare, for example, GHKCU, which I'm going to touch on here in a little bit. So the pros of these creams are that they're ideal for localized treatment, skin-related treatment, but the cons are that they're limited to surface level absorption and not as effective for systemic treatment throughout your whole body. All right, so let's get into some of the popular peptides and their uses. Now, there are at least 100 different types used in therapy, so I cannot possibly cover every single one of those in this episode, but some of these I'm going to be covering are peptides that you might have heard of already because they're most commonly used. The first one is BPC 157. So this is also known as Body Protection Compound 157. And it's sometimes called the healing peptide for its ability to repair tissues, in particular the gut, tendons, and ligaments, reduce inflammation. It can give your immune system a boost, accelerating recovery from injuries, its potential in promoting gut health through intestinal repair and healing. And to touch on this a little bit more, it may reduce inflammation in the gut, it may speed healing of intestinal wounds, and it may improve gut integrity, meaning those tight junctions in between the cells of your gut lining. And it can repair damage from leaky gut syndrome, where those tight junctions become inflamed and they can separate a little bit too much and allow unwanted substances into the bloodstream from there. And it can also help improve irritable bowel syndrome. Now, it's also commonly used with another peptide called TB500. And this protocol is often called the Wolverine protocol for its healing and recovery of tissues specifically. Now, BPC 157 can be used for tendon healing and improvements in strength and collagen organization, while TB500 is also known for something called angiogenesis, which is the rebuilding of new blood vessels, and also for its ability to reduce scar tissue formation. Now, both of these peptides may facilitate accelerated recovery from muscle strains as well. And they might do this by enhancing perfusion to injured tissues, meaning blood flow to those areas, modulating of inflammatory processes, making sure that the inflammatory processes are operating as they should be, and inflammation isn't getting out of control, and also promotion of healing satellite cells to the injured area and formation of new muscle tissue. So, this combination of BPC 157 and TB 500 can have a lot of potential to help with injury recovery and tissue healing. So, the next one is GHKCU, which I already mentioned briefly, and it's most commonly used for skin health. And it may help with collagen synthesis and wound healing, and it can specifically improve skin elasticity, reduce wrinkles and fine lines, and accelerate the healing process due to the increase in collagen production. And it's also known for its ability to help stimulate hair follicles and promote new hair growth. And it can increase blood flow to the scalp and strengthen those hair follicles. The next one is CJC 1295. And this particular peptide is known for its ability to stimulate growth hormone release. Now, growth hormone is a very important hormone that is released from your pituitary gland that is attached to your brain. And when this hormone is released, it can have specific functions like supporting muscle development, improving strength, boosting endurance, and also accelerating recovery from workouts. Now, this particular peptide, CJC 1295, is commonly used with a couple other peptides, and one of them is known as ipamorelin, and the other one is known as tesamorelin. And these can be used in a stack for muscle gain, fat burning, especially around the organs, which is known as visceral fat, and also sleep quality and recovery. I want to touch on tesamorelin real quick on its own. So, this particular peptide may enhance general weight loss efforts by targeting abdominal or visceral fat. Now, the caveat here is that a lot of this has been shown only in studies on HIV patients and not with those people with metabolic syndrome or obesity. So that sort of limits this particular peptide's generalizability to those other populations. But I would bet that there will be future studies with those specific populations. But that's important to know. And I mentioned metabolic syndrome. Now, that is a combination of 3 or more conditions like abdominal obesity, high blood pressure, high blood sugar, high blood triglycerides, and low HDL cholesterol. And that's completely different from HIV and the effect that it has on fat distribution within the body. So, very important to keep in mind. Next is semaglutide. So, semaglutide was originally developed to treat type 2 diabetes, and it can help control appetite, regulate blood sugar levels, enhance fat metabolism, and also promote sustainable weight loss. Now, you've probably seen some commercials on TV regarding this particular peptide, and it also goes by the brand names of, for example, Ozempic and Wegovy, and these are called GLP-1s, or glucagon-like peptide 1. So they really have a strong impact on appetite control, which is mainly how they work. So the next peptide that I want to talk about and that I was very, very interested to learn about is known as thymosin alpha 1. Now, thymosin alpha 1 is known for enhancing, modulating, and restoring immune system functions. Now, it has various functions and uses, including increasing the number of immune cells and improving their functioning, regulating inflammation throughout the body, decreasing oxidative stress by reducing the production of reactive oxygen species, which are known as free radicals, having a protecting effect against fungal pathogens like mold as well, and also stimulating signaling pathways that initiate the production of immune-related cytokines. And cytokines are immune system proteins that act as chemical messengers to help regulate inflammation, fight infections, repair tissues, and also control cell growth. Now, this particular function of stimulating those signaling pathways can be very helpful for people who are immunocompromised or immunodeficient. Now, there are also some extreme uses of this peptide in the research. In particular, it can be useful for people with diabetes, and it can reduce damage to the pancreas due to its ability to regulate oxidative damage. It can also be used to help regulate and reduce inflammation in people with psoriatic arthritis. And one of the things that was most interesting to me was that it is a possible approach to breast cancer treatment. Now, in studies, it was shown to inhibit, which means to hinder, restrain, or prevent breast cancer cell proliferation, which proliferation means a rapid increase in number, and also induce apoptosis, which is the normal controlled death of cells, and in this case, cancer cells. And other research also shows similar results with use of this peptide in diseases like metastatic melanoma, head and neck carcinoma, leukemia, and non-small cell lung cancer. And it can also reduce toxicity from chemotherapy and improve quality of life for cancer patients. And studies have shown fewer infections and decreased neurotoxicity during chemotherapy. In addition to that, it's also demonstrated to be a promising treatment for severe sepsis. And sepsis is a life-threatening overreaction of the immune system to an infection that triggers widespread inflammation and possibly organ failure. If that's not enough, it's also demonstrated efficacy in reducing mortality among severely ill COVID-19 patients. And one study in particular suggested that healthy people over 60 years of age should receive thymosin alpha 1 as a supplement to prevent COVID-19 infection. Now, overall, the peptide is very well tolerated, particularly thimalphasin, which is the synthetic form of thymosin alpha 1 that's often used in the studies. But there are some adverse minor side effects and contraindications. Contraindications means that there are certain people, populations with conditions that should not be taken up. And the most common side effects are local irritation, redness, or discomfort at the injection site, and the body may recognize synthetic peptides as foreign, potentially triggering an immune response. Now, this could lead to fatigue, mild fever, or more pronounced inflammation. And the contraindications are for immunosuppressed patients. So, for example, organ transplant patients, unless the benefits of taking the peptide outweigh the risks. So the most important thing, if you're thinking about using that peptide or you want to learn more about it, make sure you talk to your healthcare provider, especially if you are going to be combining any peptide therapy with any other medications or treatments to make sure that there are no adverse reactions from the combination of the peptide and the medications. So that's the most important thing. Always talk to the healthcare provider. So now let's say you are reasonably healthy, you don't have any serious conditions, and you're wondering if peptide therapy might be for you. So where do you kind of start with this? Let's start with what you should expect at your initial consultation. So I'll be talking about a couple providers and ways to find providers in a little bit. But for right now, once you actually find one, this is what you'll expect. They'll take your medical history, or at least they should be. So they should be doing this stuff, taking your medical history, your overall health, your lifestyle, any health issues you're dealing with or want to prevent, and also your desired outcomes. All right, so they should be asking you all this stuff. If you just go to a provider and they're like, oh yeah, let's get started with this peptide therapy without knowing anything about you, obviously it's a pretty big red flag, right? So make sure that they're doing all this stuff with you. So next, the provider, after gathering all this information, will recommend a specific peptide treatment. And that's based on the evaluation, your symptoms, your goals, and they might also do blood work as well. Then they'll create a custom treatment plan for you. So they will recommend a dosage, a frequency, and the best delivery method. So I talked about delivery methods at the beginning of this podcast, whether it's oral, whether it's injectable or cream, one of those. So after you start, there should be ongoing monitoring with your provider based on how your body responds. That's very, very important. And there should be gradual dose adjustments, which is also known as titration, to optimize your results and also limit any side effects. So once again, another red flag is, all right, if your provider just, gives you the peptide therapy and they're not monitoring you, they're not adjusting or titrating your dose as you continue on through your therapy, pretty big red flag there as well. So they should be doing that. All right, so that's basically how the process works. Now, I want to talk about the importance of working with trusted providers because in peptide therapy, there are a lot of gray areas, which I'm going to be talking about here very, very soon. All right, now, when you're looking for trusted providers, as of right now, I have never done peptide therapy. All right, so I want to make that absolutely clear. I don't have the means for it right now, and my body is generally pretty healthy. I've not had any serious injuries or conditions that would that really have prompted me to look into peptide therapy for myself. All right. So this is purely based on my research and not my experience. So I'm only willing to recommend specific providers that have specific credentials at this point. So based on all that, when you're looking for a provider, look for the following. All right, they're either an MD, which is a doctor of medicine, right? And those are the providers that are actually giving you the treatments. And an MD is a physician trained in allopathic medicine or Western medicine, which focuses on disease diagnosis and treatment, prescribing medicine, and performing surgery. But there are also MDs out there that take a holistic approach as well, rather than just treating symptoms. Okay, so the next trusted provider you should look for is a NMD, all right? And this is a naturopathic doctor. So a naturopathic doctor is also a primary care provider, but they're trained in naturopathic medicine. Naturopathic medicine is a holistic approach focusing on the body's self-healing ability using natural, least invasive methods like nutrition, herbal medicine, and lifestyle changes to treat root causes of illnesses, though their licensing and scope of practice vary significantly by location. And last is a DO, or Doctor of Osteopathic Medicine. And this is a fully licensed physician in the U.S. who practices medicine with a distinct patient-centered holistic approach, viewing the body as an interconnected whole and emphasizing prevention, lifestyle, and hands-on treatment, also known as OMT, or osteopathic manipulative treatment, to support the body's natural healing processes. DOs still complete med school and residency, and they can specialize in any field, and they have full prescribing and surgical rights, but receive extra training on the musculoskeletal system. So with peptide therapy, probably most often, right, based on my research, it seems as if NMDs and DOs are the most common out there that will do peptide therapy, although still look for MDs too because they might do them as well if they've kind of transitioned to more of a holistic approach. All right, so here are a few providers I am willing to recommend at this point of my peptide research, and also based on recommendations from other trusted professionals. So online, I found a company called Relive Health, and they're a health franchise brand. And MDs and DOs are running their show over there. Now, they have locations around the U.S., and they might not be in your specific location. So check the website for your particular state. And I'll be putting that website link in the show notes. Now, I live in Las Vegas, so there is one particular location that was recommended to me by another trusted health professional out here, and that is TRT MD Health Clinic. And once again, a DO is running the show over there. And also, there is a website known as the International Peptide Society, which I'll also link in the show notes. And they have a Find a Practitioner tab. I poked around there for a little bit, and some of the places on the map, they didn't have a lot of details. One or two didn't exist, but there were also a couple links that took me straight to their website, and I was able to learn all about them and everything. So you just have to be a little bit patient when you use this website. I'm not sure how often they update it, but that is another resource you can go to find a trusted provider or practitioner in your specific area. All right, before I move on to the gray areas here, I want to be absolutely clear about something here. I wouldn't recommend just buying a random product sold as a supplement online without working with a provider, especially if you're taking any prescription medications. So always work with someone who could guide you through the process, as I talked about before, so that they can titrate you up or down based on your needs and how you're responding to the therapy. Don't just find something out there, buy it, and start taking it as kind of like a shotgun approach, hoping to solve a particular problem, right? So I definitely would not recommend that. Now, let's get to some of these gray areas here with peptides. The last thing to be aware of is FDA approval and legality. Now, peptides are largely unregulated, and a lot of them are not approved by the FDA for use in humans. So, if they're unapproved, how are so many people using them? There's another interesting article that I am going to link in the show notes, and that is from August of 2025 on legal info regarding peptides. So definitely recommend that you guys check that one out as well, even if you're a provider too. So it has a lot of good legal information in there. Now, in the wellness and anti-aging space, like I said, there are gray areas and loopholes that people can get this peptide therapy. First one is the term non-FDA medications is often used for anti-aging, tissue repair, or longevity optimization. And that term is often used to describe peptides, NAD, methylene blue, and other similar products. And it's also used to signal that they're not approved, but are being offered anyway under a medical wellness framework. Also, some are being sold online as research chemicals with disclaimers like not for human consumption. Some physicians in regenerative and anti-aging spaces also attempt to source them from what are known as compounding pharmacies, which are specialized pharmacies that create customized medications tailored to a patient's unique needs, rather than a traditional pharmacy that dispenses mass-produced, commercially available drugs. So as the consumer, just be aware that whenever you use an unapproved peptide, you have no guarantee of its identity, purity, potency, or safety. And if you do use them, it's still best to go through one of the healthcare providers I mentioned earlier. As it currently stands, the only legal ways a physician can provide a non-FDA approved drug are through highly regulated programs like clinical trials, which are for research, not routine treatment, expanded access for patients with serious or immediately life-threatening diseases who have exhausted all approved treatment options, or through the Right to Try Act, which is similar to the previous one, and it's also reserved for patients with a life-threatening condition where the drug has completed a phase 1 clinical trial, which is the first step in testing a new drug or treatment in humans. So as a consumer, I want you to be aware of all that stuff, but still know that there are loopholes and workarounds if you want peptide therapy. Okay, so now I want to circle back to each one of those peptides that I covered at the beginning of the episode, and I want to touch on if it's approved or not, and also how it might be marketed to you, and any other relevant information on that particular peptide. Okay, so circling back to BPC 157. It's not approved for use in humans, and it's labeled as an unapproved drug that cannot be legally prescribed or sold over the counter. Now, here's where I start to get a little bit irritated with how long these particular peptides are taking to get researched and approved and used legally. I found this recent narrative review article published in Current Reviews in Musculoskeletal Medicine, which is a peer-reviewed scientific journal, and it states that, I quote, BPC 157 demonstrates robust regenerative and cytoprotective effects. Cytoprotective means protective for the cells of your human body. In preclinical studies, positioning it as a potentially valuable tool in musculoskeletal medicine. Despite its growing popularity among athletes and its wide availability through non-regulated sources, there is minimal human data available. Until well-designed clinical trials are conducted, BPC 157 should be considered investigational and its use approached with caution. This review highlights that given the robust preclinical evidence and high public interest, there is a critical need for well-designed human trials to assess the safety, efficacy, and clinical utility of BPC 157 in musculoskeletal medicine. So let's do some research. Come on, let's keep it going. All right, so I found that particularly interesting in that article. And I also have something pretty similar with thymosin alpha 1 here in a little bit. So next, TB500 is also not approved by the FDA, and it's often sold as a research chemical. GHKCU is not approved by the FDA for therapeutic use, although it's often used in creams, and cosmetic product ingredients don't require FDA approval unless they're color additives. CJC 1295 is not approved by the FDA for therapeutic use and often sold as a research chemical as well. Tesamorelin. It's only approved by the FDA to reduce excess abdominal fat in adults with HIV and lipodystrophy, which is a rare group of disorders causing abnormal loss of body fat from some areas, like subcutaneous areas, meaning underneath the skin, while it builds up in others, like the organs, for example, the liver and the pancreas, or the blood. This can lead to severe metabolic issues like diabetes, fatty liver disease, and high triglycerides. Semaglutide. It's approved by the FDA under several brand names, including the ones I already mentioned before, Ozempic, Wegovy, and Rybelsus, primarily for type 2 diabetes management and weight loss for those who are overweight or obese. And this in particular is very, very important for those using one of these peptides for weight loss. Since they have such an effect on your appetite and they do work for weight loss, that also means you're losing muscle mass in the process. So strength training and adequate protein intake is very, very important if you are taking them. All right, so I wanted to make that clear. Now, just a little extra information for you on semaglutide. It's a GLP-1 receptor agonist, which I already mentioned before, which is a substance that binds to a receptor and activates it, mimicking the body's natural processes. And GLP-1 is released in the small intestine and pancreas to release insulin, which slows stomach emptying and signals fullness or satiety. And this results in less food intake. So I want to make sure you understand how that works. All right, the last one that I'm very excited about is thymosin alpha 1. It's also unapproved by the FDA, although it is approved for use in over 35 other countries, primarily located in Asia, Latin America, the Middle East, and Eastern Europe. It's also significantly used in China for cancer and infections. There was a review article published in 2024 in the journal Alternative Therapies in Health and Medicine on the effects of thymosin alpha 1 in over 11,000 human subjects in more than 30 trials. And it concluded the following. Based on substantial evidence from clinical trials, thymosin alpha 1 emerges as a well-tolerated and effective immune modulator. The FDA's restriction appears unfounded, meaning having no foundation or basis in fact, as thymosin alpha 1 has shown safety and efficacy beyond the initial specified conditions. Urgent attention and intervention are warranted to ensure the continued availability of this life-saving peptide through prescription. Therefore, it is recommended that the FDA permits 503A compounding pharmacies to compound thymosin alpha 1, considering its potential to treat a variety of conditions effectively. And the variety of conditions include COVID-19, autoimmune conditions, and cancer treatment. All right, so my take-home message for general use of peptides is this. If you're having health problems like chronic pain or GI issues that you are considering using peptides to solve, or you just want to optimize your health, I will always recommend to look at your lifestyle choices first. Consider these. Are you eating whole, minimally processed foods at least 80% of the time? Or is most of your diet composed of ultra-processed, hyper-palatable foods, which you can learn about in my book, and the link is in the show notes. Are you lifting weights at least 2 days per week? And are you lifting them properly? Do you have mobility restrictions you are not addressing? Trying to work through those mobility restrictions rather than improving them and reinforcing proper movement technique can keep you in chronic pain that you think can only be solved with a magic injection. Are you performing moderate to high intensity cardiovascular training at least 2 days per week? Are you walking at least 7,000 steps daily? Or are you sedentary the majority of the week? Are you sleeping long enough? At least 7.5 hours per night? And is that sleep of high quality with adequate deep and REM sleep cycles? Or are you waking frequently or waking up in the morning feeling exhausted? What's your social life like? Do you have meaningful relationships in your life? Are you building connections with others? Mental health, isolation, depression, and anxiety can also feed into chronic pain and depressed immune function. So these are all lifestyle factors that I want you to consider very, very hard and ask yourself if you're actually following through with those. If there's room for improvement there, I would try really, really hard to improve all of those and see if your pain improves or if whatever other function you're struggling with improves before you reach out to peptide therapy, because it's also very expensive too. So I don't want you to be wasting your money if you don't have to. I'm always going to advocate for a healthy lifestyle for everybody. Okay, guys, that's it for today. I really hope you got a lot out of this episode. I really enjoyed looking into all this stuff, and really, I've only scratched the surface with peptides. So I'm definitely going to be looking into them a lot more. I'm going to be looking into having a healthcare professional as a guest at some point, someone who is really, really well versed with peptide therapy. So I'll be sure to communicate that to you guys whenever that happens. But for now, if you enjoy the show, please follow it on Spotify, Apple Podcasts, or YouTube. Introduce it to your family, your friends, your colleagues, and also please leave me comments and suggestions for other topics that you would like to learn more about. And lastly, you can find me on social media on Instagram at coach_A_wolf, and also follow my YouTube channel at Wolfpack Fitness. I put all the podcasts on the YouTube channel, and I have over 700 exercise technique, stretching, and self-myofascial release videos on the YouTube channel as well. So definitely go over there and check those out. There's a lot of value to be gained from the channel. All right, guys, thank you so much for listening. Make sure you tune into the next episode. I'm thinking it might be a New Year's resolution one. That's always a fun topic. So I'll talk to you guys again soon. All right, thanks and take care.